So now we will come to the chapter PTC, that is Pharmacy and Therapeutic Committee. So first question you note down, that is define PTC, discuss the function. So as a definition part, the hospital as an organization establish a system known as the Pharmacy and Therapeutic Committee, which is called as PTC, in response to the rational use of medication. The PTC formulates the policy regarding therapeutic use of drugs, playing dual role as an advisory and a educational body Now let's see about the functions of PTC. So first point is the PTC develops, compiles and rectifies the hospital formulary system, which is appointed by the elected or governing board of the medical staff. This adaptation is done as per the need of individual hospitals. Number 2 is hospital formulary is being revised and reviewed time to time by PTC. So PTC actually is reviewing time to time the hospital formulary. Third point is the PTC responds to rational therapy, which helps in preventing duplication, wastage, as well as confusion. Number 4 is PTC recommendations are mainly adopted by medical staffs. Number 5 is PTC develops procedures, written policies and guides during the selection, procurement, storage, as well as the distribution. Number 6 is problems related to drug use, administration, distribution, stocking, and drug reactions are solved by PTC. So if any actually problem occurs during the administration and distribution, in case of stocking or any adverse drug reaction or any drug action happens, actually these are solved by PTC. Then advice has been given by the PTC to the pharmacy regarding drug distribution and control procedures. The drug safety policies are being developed by PTC. The development of training programs for professional staffs are done by PTC. The last point is the duplication of the same basic drug and drug products are being controlled and minimized by PTC. So next question we come actually, what is the role of PTC in drug safety? So that is very important question. It may come in broad question also. As a hospital pharmacist, we are dealing with human life, and for that extra care and cautions should be taken while using and dispensing the drugs. So the main responsibilities of drug safety comes under consideration. Though as the safety aspects were taken for granted here, the accidents due to drugs occur so infrequently. However, if such accident occurs, the role of the PTC comes into the focus and the steps regarding the crisis management are being taken. Here thus the PTC can play an effective role in ensuring the drug safety on a continuous basis. So since drugs are potent substances, so safety awareness is must to maintain in all the hospital departments, mainly the hospital pharmacy department should be very careful of it. The safety factor is being regulated by the PTC, and for that reason they developed a checklist which is as followed. Number 1 point, let's see, that is whether the qualification of the pharmacist and his assistance adequately qualified enough? Number 2 is whether dispensing practice done by any non-pharmacist? Number 3 is there inadequate manpower in hospital pharmacy to handle the workload? Number 4 is the hospital pharmacy have enough space or not? And how is the storage facility? Number 5 is whether a documentation center or library is present. Number 6 is there any manufacturing unit present? If yes, then proper GMP is followed or not? Number 7 is there any physical verification of expired or deteriorated or expired drugs? Number 8 is how are the internal and external preparations separated? Number 9 is how are the poisonous and non-poisonous preparations separated? Number 10 is there any policy of dispensing in off hour? Number 11 is there any training programs so that the pharmacist can teach other professionals in this matter? And number 12 is there any dangerous drug regulation present? Question number 5. Give short note on PTC and emergency drug. So in which case actually PTC comes under consideration in case of emergency drug? What are the rule for them? The PTC prepares the list of emergency drug and supplies to prepare such emergency kit or boxes which are then placed in the ward. The emergency box contains needles, syringes, ampules and drugs like atropine sulfate, digoxin, amyl nitrate, atropine, neostigmine, corticosteroids, mannitol, saline for injection, water for injection. The list is constantly reviewed by the PTC time to time for the need of the hospital. Give short note on adverse drug reaction and PTC. The adverse drug reaction cases are increasing day by day as a result of complex drug therapy. The problem actually can be tackled at two levels. That is, first of all, we have to know how to prevent the adverse drug reaction, and second, how to treat them. So first of all, we have to actually identify and prevent the ADR. A reporting. So how actually we have to do that? A reporting system is made for this purpose. As per the ADR reaction report, so that is called as ADR, that is adverse drug reaction report. Here actually what things we have to mention, that is name of the drugs, then the route of the administration, then the date of starting and ending treatment, the indications for which the drugs were used and adverse reaction noticed, and another thing is the physician or ward or nursing staffs transmits this report to the chairman of the PTC, and the same is placed with the medical room. So such actually when report is prepared actually with the results and what are the procedures so they have followed to tackle such adverse drug reaction, those are being transmitted to the one report is transmitted to the chairman given, and the same are placed within the medical room. Then the PTC interacts with the bodies like DTAB and FDA. Question is there that give the name of any three subcommittees of the PTC. So here you have to give the subcommittee of cardiovascular, subcommittee of CNS agent, subcommittee of gastrointestinal agents, So there are several actually types. You can give any three. Okay.